One significant factor of the 2025 general election was the late release of party platforms and their policies, specifically for the PLP and the FDM. Now, the OBA had their platform out for much longer than any other party, giving the people of Bermuda time to read over their goals. The FDM rolled out their platform in pieces starting in July of 2024 with their education platform, but their healthcare policy wasn't released until 4 days prior to the general election on February 14th, and the PLP didn't release their full platform until February 6th, 12 days before Bermuda voted for its future. So this sparks the question, how many Bermudians had the time to read each party platform before they voted? Healthcare is one of the biggest issues in Bermuda right now. People are struggling to afford it and justifying a life without it when given the choice between food and care. Now that the votes are counted, let's look at what the people have chosen and what they did not. The PLP won the election, promising universal health care, expanded benefits, and more support for mental health. But the opposition parties, the OBA and FDM, had their own ideas. The PLP wants to guarantee that every resident has access to medical care, expand HIP and future care, and increase mental health funding. The party also promises a new physical rehabilitation center and plans to modernize Bermuda's Mental Health Act. Their platform was concise and detailed. Meanwhile, the OBA proposed a national healthcare plan that regulates costs and ensures accountability in hospital funding. They also aimed to better coordinate senior services and create community blue zones for health-focused living. Their platform didn't expand on mental health services, and it wasn't as detailed. Now, the FDM took a market-driven approach, calling for pricing transparency, increased competition, and allowing cash-only medical practices to lower costs. They want the power to be held by the people and allow more options for personal choice. And in terms of mental health, they propose decriminalization of addiction and expanded rehab programs. Their platform was the most extensive and detailed. Here's a graphic that takes a look at each party platform and their policies listed side by side on what was mentioned with each platform and what was not. Now, in terms of the PLP's platform, universal healthcare was protested against 5 years ago. Many medical professionals expressed their disinterest, but others fell on the lines of agreement. In 2023, Minister Kim Wilson announced that there is a universal healthcare steering committee along with the 2022 to 2027 healthcare strategy for Bermuda. The latest from the Gazette in a report from December 2024 was how Premier Burt says that the $50 million in funds that was added to the universal healthcare is just the start, as it's still a major priority for the party. With healthcare remaining a top concern for Bermudians, the question now is, will the PLP incorporate any of the ideas coming from the FDM and the OBA? The Premier said he's willing to work with party leaders, and we've seen evidence to that. But historically, collaboration in Bermuda's political landscape has been rare. So, what does this mean for you? If you voted PLP, these are the policies they promised. If you voted OBA or FDM, your party's healthcare ideas might still influence future decisions, but that solely lies with the current government and what they decide. The key question remains, will Bermuda see real progress toward more affordable and accessible healthcare? And will the people of Bermuda push for any of their party's ideas?